So hey, my name is Stephen Dunn. I'm a licensed physical therapist in Texas. I've been practicing for 25 years. And one of the biggest things that are missed with dealing with back pain is the actual strength of the pelvic floor. And strengthening of the pelvic floor is so often neglected. People are taught to do Kegel exercises, but a lot of times they're taught to do them incorrectly. And so I just want to talk about that a little bit. And I want to talk about two things. One, I was just driving home 16 hours from spring break in the mountains in Colorado. And with driving home, I was having some tingling in my toe. And it's some kind of like, I felt like it was scratching. I felt like it was itching, basically. It was itchy. And I was scratching it. I took my foot, not my foot, took my shoe and sock off, and I was scratching it and, using my sock to scratch it. And I was like, man, I feel like I have like some almost like some scratching, like an athlete's foot sensation. And none of the scratching was relieving it at all or satisfying it at all. And then I realized, oh, that's a little bit of this tingling that I get sometimes when I sit too long. And I realized that it was actually coming from my back. Now, as I sat there, I started going, what can I do about this? I'm gonna be in the car for another 12 hours. And so the first thing I did is start doing a little pelvic floor education, or a little pelvic floor strength. So by lifting the pelvic floor, holding it for about 3 to 5 seconds and relaxing, lifting the pelvic floor, relaxing, literally 25 to 30 reps of those, the tingling and the itching sensation in my foot was already starting to subside. Then I started adding in some deep abdominal contractions, some of the transverse contractions with the pelvic floor contraction. And within about 3 minutes of doing that, with some conscious effort of inhaling, relaxing, and exhaling, contracting, the numbness, the tingling, the itchy feeling was completely gone in my foot. About an hour later, it started coming back, and before I let it come back, I just started doing it again. Pelvic floor lift, deep abdominal contraction. So I want to talk a little bit about what that actually is. So I have a pelvis here, and we're going to use this little band, this little sling to represent what the pelvic floor would be. And actually it's a lift of the pelvic floor is all a Kegel is. Most people talk about tightening stopping the flow of urine. Well, that's completely wrong, because when you stop the flow of urine, it's a sphincter that is only designed to open when it's time to void. So when we're telling it to close, it's really an improper neurological message to our body. So it's a lift of the sling. It's not a closing or tightening or stopping the flow of the urine. Again, one of the biggest misconceptions of pelvic floor and Kegels. Should Kegels be done for women only? No, men should do them. I just explained how me doing a pelvic floor strengthening for 25 reps started making changes in 3 minutes, 5 minutes of doing it. My symptoms were completely gone. So just wanted to clarify that is not just for women, it is for everyone with a pelvic floor, which is everyone. So with that said, that is my message today about using the pelvic floor strength to help with back pain. Pelvic floor strength the pelvic floor is the bottom of the core. It's the bottom that holds everything in place. Front of the core is the abdominals, back is the multifidus, top is the diaphragm. That's the message for today, guys. Y'all take care.